Welcome to Atheists Talk. I'm your host, Grant Steves. And this evening I'm interviewing Tim Stanley from Planned Parenthood. Tim is the Public Affairs Director of Planned Parenthood for Minnesota, North Dakota, and South Dakota, the region. And in starting out, I wanted to give some background on Planned Parenthood, the services that they offer in this region and in the state, because I think, again, this is a very important thing to continue to bring to the public, the importance of Planned Parenthood. I think it's one of the most positive reproductive and concerns for women's health, men's health in this field.
Sure. Well, thank you, Grant. It's always a pleasure to be here. Any opportunity I can to talk about the good work of Planned Parenthood, I take it. So I'm glad to be here. And yeah, just in brief, we are a 3-state affiliate, so Minnesota, North Dakota, and South Dakota. We serve about 65,000 patients every year. We actually have education programs that serve another 20 to 25,000 patients every year. And 95% of what we do is focused on prevention, the prevention of unintended pregnancy, the prevention of sexually transmitted infections, also the screening and treatment of cancers, mostly for women, cervical and breast cancer screenings as well. So, you know, what we do we are an expert in reproductive health care. We provide our services at little or no cost. 81% of our patients obtain their services at little or no cost. And for us, it's a mission that we, feel strongly about, and that we also think that, for us, our role is to give men and women of our 3-state region the information and the services they need to stay safe and healthy. And that's what we believe in, that's what we practice, and it's our clinical services, but it's also our advocacy programs as well. And
to get a perspective on this, because we're going to look at the national scene, Planned Parenthood is not just state or region. This is a very large national organization that help throughout the country.
Sure. Oh, you're absolutely right. And we are, again, one 3-state region, and we're one of the bigger regions around. Okay. But I mean, there is a Planned Parenthood in every state. Many, some states have hundreds of Planned Parenthoods. California, Florida, for example. We are one that geographically is huge, but we are a nationwide organization, and we are probably, based on the last statistics that I saw, one of the most recognizable brands, so to speak, in the country. Right. When it comes to positive public perception, we rank right up there with the United Way.
Right. And the thing that I find interesting is when I first thought of and encountered Planned Parenthood, it was on the negative side of the abortion, because I happened to be getting MCCL literature. And I thought that was the sum total of Planned Parenthood, and some people get that message in the news because of the picketing and that kind of negative. But the fact is, as you've indicated, most of your services, about 90% of your services or more, are really focused on the health of the individuals and preventative kinds of activities.
Absolutely.
And that's important message to get out to the people.
I mean, we are an abortion provider. We're proud of that. We would never, ever shy away from that. We are an advocate for abortion rights. But we think actually what comes with that, when you start talking about abortion rights and you start talking about reproductive rights, you really start talking about a woman's ability to control her reproductive life, control her dreams, her destiny, what have you. That is really where we come in. We are about making sure that, all the information and services are available to women, so that they can definitely make sure that their destiny is explored and is lived on.
You made a comment during our chat between segments about the fact that Planned Parenthood probably has prevented more abortions than the people who are trying to prevent abortions.
Yeah. Because
of the policies that you've followed, because of the education work that you do. And this is something that would be a good lesson for them to learn, the positive side of it, and how a message can help people.
Yeah, I've been, in this field for about 15 years now, and I agree. I feel that, if we could, and every year we seem to do this, we call on our opposition to join with us, and let's support legislation, let's support funding that actually helps women, helps families, be able to make responsible choices, make responsible decisions. And that is really where we would welcome the input of the quote-unquote pro-life groups. But we do say, we say it very seriously, that the irony is that we are protested every day because we're an abortion provider, and yet we believe very strongly that we do more in one day to prevent the need for abortion than many of these abortion protesters will ever do in their entire life. And we're proud of that, and that's something that's a benchmark for us.
You also made a comment in the last segment, but I think it's worth bringing up and reminding people that the state of Minnesota, though we have these services available, there are people obviously not using them because our STD rate has gone up, hasn't it?
Right, yeah, it has, and it's since 1996, every year for the last 13 years, we've seen an increase in the number of reported sexually transmitted infections. And I definitely think that comes down to, just in 2008, we supplied 56,000 tests for sexually transmitted infections, a huge number. We're basically starting to peak out in the number of tests that we can even do. We need to we need to basically go downstream, and we need to provide more education, more work at the community level to be able to educate people about what causes the transmission of a sexually transmitted infection, what causes it, what can be done to prevent it, and then if worse comes to worse, what can be done to treat it. But for us, right now, the rate of infection is skyrocketing in Minnesota of all sexually transmitted infections. And I think, nationwide, we were just talking about nationwide, in America, 1 out of 4 teenagers, will have an STI this year. That's a remarkable thing, and we need to do something about that.
Well, I'm pleased to be a little bit of help here in helping to educate people about the services of Planned Parenthood and specifically about those issues where they can be prevented, and that we reach out to those people and try to educate them as much as possible. And Planned Parenthood, as you have indicated, really have done a service to the community in a way that is not always appreciated by the general public, or because maybe they're not aware of it.
Yeah.
And so this is one of the steps in awareness.
Well,
tonight.
we appreciate the opportunity. Great.
The questions that I have in this segment will be moving, as I indicated, towards the national scene. Primarily because I know that in the last year, with last few days actually, we have changed administrations, and there has been, even within that 60 days, 70 days now, there have been changes that have affected the rights of women.
Mm-hmm. Oh, absolutely. Fundamentally, it's been remarkable. I mean, I will, of course, as an organization, we backed Barack Obama. We did what we could through our state and federal political organizations to support Barack Obama. That's not a secret. We're proud of it. Barack Obama is an outstanding pro-choice politician. I mean, at bottom, what he really believes in, again, is giving people information. He is not afraid to say that women and girls need to be educated, and that he is a father. He's a conscientious man. He believes in education, and for us, we couldn't ask for a better advocate. But just in his first 90 days, if you will, he has done some amazing things for women already, and I think liberated people across the world with just a few actions. The first one is the repeal of the global gag rule that he did. If just to educate your viewers, this is a policy, if you will, called the Mexico City policy that Ronald Reagan put into effect, that basically said that no U.S. funding can go to any organization overseas that advocates, that would refer or provide abortion, or basically counsel on abortion services. Right. This would mean that largely, AIDS clinics, sexually transmitted infection clinics, birth control clinics, if they would even consider referring a woman for an abortion, they could not receive any federal funding whatsoever. So that went into policy when the Reagan years, was renewed when George Bush I came in, was repealed when Bill Clinton, his 8 years, came back when George W. Bush II was in, and now was repealed under Barack Obama. It is a huge policy. For me, it's about exporting our ideology, and it is about basically enslaving women overseas to our politics. And women across the world need access to information to be able to make the decisions for themselves, not based on our bureaucratic decisions. But that's not the only thing that he's done. Second thing that he's done is for us as a healthcare provider, has repealed, basically made a change that there was a something called the Deficit Reduction Act of 2005 that basically made birth control much more expensive to community clinics and to college health clinics. And for us, that was a devastating thing. It drove up the cost. An example I use is in Fargo, North Dakota. A woman, a college student at the college up there was paying $17 for a month for birth control cycle, went up to over almost $50 in the course of 1 year because of this bureaucratic snafu of the Deficit Reduction Act. Barack Obama repealed that, changed that law, passed Congress, he signed it, and now we've got more lower cost contraceptives available as a safety net provider for women across the country. So there are things like that. They seem small, but they're huge. And it's just sort of like to know that we have an advocate in the White House who, again, really believes in women and families is a great thing for, I think, honestly, for all Americans.
Yes. I like the idea of stating it to people that this is pro-choice, not pro-abortion.
Mm-hmm.
There's no one here that's advocating abortion.
Mm-hmm.
In fact, I would say that we both agree. Abortions are the things that we don't want to have happen,
mm-hmm.
but we want people to have the choice
mm-hmm.
if there is that situation that occurs.
Mm-hmm.
And sometimes people get that message mixed up.
I do, and Grant, what I like to think about is I like to say, I want to prevent or reduce the number of women who ever have to make the decision
Yes.
about what to do with an unintended pregnancy, regardless of what that decision ends up being, that ever have to be put in that spot. If I can make that number as small as possible, that's what I consider to be my goal and our organization's goal as well. What they do with that decision once they get all of their options, we support them in that decision, but to get into that situation where they have an unplanned pregnancy, whatever the decision is traumatic in and of itself. And we want to make sure that that as few women as possible get put in that position, and then whatever their decision, they're supported.
And in the state of Minnesota, as we've indicated, we really have a fairly good educational system in terms of sex ed
mm-hmm.
compared to most states. And when you consider here we're having problems, and we have a program which in most cases, especially in the metro area, is probably a more progressive sex education program than in other states. What is happening in those other states?
Yeah. Well, I think, Minnesota, I would just say that I think it's a little bit touch and go. I mean, it really depends on the school district. I think that there are largely, I think Minnesota is not as bad perhaps as it could be. There's no doubt about that. But it's a school district by school district decision.
Okay.
And they are, I believe, essentially being bribed to, at least in the previous 8 years of the Bush administration, to teach an abstinence-based model when it comes to education, because there was subsidies available, there was matching funds available from the federal government, and to the tune of, in just 8 years, $1.5 billion spent in these abstinence-only education programs that have been proven by nonpartisan scientific research to have no effect at all and do not prevent young people from having unintended pregnancy or the transmission of sexually transmitted infections. So it's a terrible waste of money, and in these economic times, at minimum, we need to doing what we can to educate people more, not educate people less, and all of our resources need to be garnered in that direction.
Now, that to me is an appalling kind of statistic that you would spend that much money in essentially throwing it away because mm-hmm. it was so ineffective, and the studies have proven.
Yep, it's been conclusive. There's no doubt about it.
That it's conclusive. Now, what have the states been doing in the last couple years to some states, some legislators, to bring about a change in Roe versus Wade?
Sure.
Are there attempts to still undermine and change?
Sure. Yeah, there are states. We have 50 states and 50 different legislatures, and they're all oftentimes up to all kinds of no good when it comes to reproductive rights and restrictions. I mean, I say that jokingly, but it's true. And I think actually our neighbor to the west, South Dakota, which is in our jurisdiction, and we work in South Dakota, in 2006 and 2007, basically had abortion bans on the ballot. And the circumstances were a little different, but the results were the same, and the practical outcomes could have been a challenge to Roe versus Wade. In 2006, the legislature passed and the governor signed a ban on all abortions, except for when the woman's life was in jeopardy. A clear, Yes.
Incest?
Exactly. No exception at all for victims of sexual assault, for incest, or anything like that. Okay. And that was with only a life exception. And that case, basically, if we had let that stand, would have gone to the court system. Would it have gone to the Supreme Court? I don't know, but it would have gone to the court system. And what we did was we basically said, wait a second, that's not good enough. We need to build a movement here. And so we basically did what you can only do in many of these ballot and referendum states is you can challenge a law. You can put it on the ballot and say the people are going to try to repeal that law. And we did that. We got the 17,000 signatures we need to put it on the ballot, and then we repealed it, and we won by almost 12 points. So we prevented a case from going to the Supreme Court in 2006. 2008, very similar thing happened. They changed it slightly so that there was an exception for the life of the woman and some circumstances of health, but not all. And we defeated that one by more than 10 points. So South Dakota is in a case, and there's others where states are trying to get cases into the court system, which a court system that is much more conservative than it was just 8 years ago. George Bush has appointed nearly a third of the federal judiciary now, and these are all, I do know of no exception to the rule that they're all a staunch conservative, largely anti-choice group. And so that's something that definitely has happened. So states are up to these things. Fortunately, there's no case that I know of right now rising through the courts, but that who knows how long that will last.
Yes, I think people, because usually these justices aren't appointed in mass. You know, there's one here and one here, and you don't keep track of them necessarily. And 3 of those justices appointed by Bush are staunch conservative. Definitely have stated, at least some of them have stated, they would like to overturn Roe versus Wade if they get the right case. And yet, you seem to be somewhat positive. You don't look at it completely with a negative attitude, that maybe there's a chance that it wouldn't be overturned.
Yeah. You know, I guess I just, at this point, it's really hard to read the tea leaves on what the strategy of the ardent opponents of abortion is. You know, are they going to continue to go with what we would call the chipping away at Roe versus Wade, where you basically don't have to, their theory is you don't have to overturn Roe versus Wade to make abortion essentially inaccessible in the United States. And they've come pretty far with waiting periods there, with restrictions that just target abortion providers, with funding restrictions, all these types of things that, it is much less accessible than it was in 1973 when Roe passed. So there's a debate, I think, in their movement basically saying, do we continue to go with this chipping away, or do we go for the outright South Dakota example where we're just going to declare a state to declare abortion illegal and take it to the courts? And I think there's a conflict about which strategy to go through. And I think that I have heard them say, many of the conservatives, that they don't believe they have the votes on the court right now to overturn Roe versus Wade. I personally don't want to, take that risk. But I think that I guess I'd have to say at this point, do we have 5 justices of the U.S. Supreme Court that are, that we can put on record as being anti-Roe? Probably not, but could we put 5 that are anti-abortion for sure and would want to further restrict abortion rights with Supreme Court cases? I'd say absolutely.
And that has to do with the precedents, doesn't it? That we can create restrictions without overturning the precedent of Roe versus Wade, and that chip until finally it's
Yeah, I mean, if you think about it from purely like a political and a public relations point of view, would you really want to either be president or even on the court if Roe versus Wade were actually overturned, so that you opened your newspaper up or you went online and it said, big bold headline, Roe versus Wade overturned? I mean, there'd be chaos. There would be riots in the streets. People would be, in all seriousness, there'd be protests. It would be an ugly, ugly situation. Rather than go the other route where you can continue to chip away, continue to take the most vulnerable women, basically make abortion inaccessible to them, the low income, the women who don't speak English, the non-affluent, people without transportation, you name the list. If they can continue to make abortion inaccessible to them, they don't need to overturn Roe versus Wade. And so I think that that's really the strategy they've had for 30 years, and it has worked to many degrees.
Sure. And again, it's like the appointment of a judge now, and not a judge. You spread it out over time, and you don't really notice that things are changing. And you see, well, okay, you have to travel 50 miles, then 100 miles. Oh, it's just miles. But for a poor person, to have to travel let's say we couldn't have an abortion in the state of Minnesota, you'd have to go to Milwaukee, Wisconsin. That's quite a drive. It's a difficult problem in the first place in terms of health. It really is a strain financially and health-wise, everything.
Yeah. Yeah, and you know, I just think that is just so important for us as a nation to, and I think Barack Obama can really lead us down this path because he is a uniting figure. He's a transformative, uniting figure, and I think the politics of old, I'm hoping, will not hold anymore. And I think that that means is that these ideological, these divisive debates, these polarizing debates around contentious social issues like abortion, I want us to do everything we can to just refocus, getting back to where we started our conversation. 95% of what we do is about prevention. Let's focus on that 95% because the vast majority of Americans agree with that. Let's stay there. That is the zone where we as Americans should be talking about giving access to more health care for more people. We have 47 million Americans are without health care in this country. That is a crime. We need to do everything we can to give people more access.
That's, I think, one of the points you made there, I think is very important to point out, to re-examine, and that is in terms of the population's attitude, that it seems more people have a positive attitude toward the issues that Planned Parenthood supports, that they are more positive toward reproductive freedom, that maybe they would compromise in certain areas in restrictions, but on survey after survey, it shows abortion rights are way much higher than they were, say, in 1973, certainly.
Oh, I totally agree with that. And you look at it this way, too, and you just say birth control, you know, which is, again, what we, primarily do in addition to all of our other services. Like 98% of women will use birth control, American women will use birth control in their lives. You know, that is a huge breakthrough. I mean, the pill has only been available since the 1960s. You know, that's a remarkable transformation of the public on this issue. And so I believe that that's what gives us the broad public support that, you know, believes that Planned Parenthood services are available. If my daughter needed a place to go, I would want her to go to a place like Planned Parenthood that would give her and her decision the respect that it deserved.
Do you see this also affecting the parties? It seemed to me that after the last election, that the person who was put in charge of the RNC, a man named Steele, essentially gave a statement that was rather pro-choice, and then the people, the hardliners in the Republican Party just sort of beat him up.
Yeah.
But it sounds like they are rethinking some of their
Boy, it's so hard to believe, you know, it's like, you're right. When I first heard that of Michael Steele's comments, I mean, I kind of thought, boy, I wonder if that's a trial balloon that they're throwing up there. They said, let's give this a shot. You know, I guess, you know, the one thing I'd want viewers to know is that, you know, back in the pre-Roe era, that it was actually the Republicans that were more about changing the anti-abortion laws than it were the Democrats. At that time, the tables were completely turned. You know, my personal, you know, family is, you know, I come from a Republican family, you know, virtually all pro-choice, you know, Republicans. It's a proud tradition, and that has changed. You know, obviously that has changed. The parties have been taken over by people that, you know, and sort of stake you know, clear claims on this issue. I don't know if we're there yet at transformation in the parties. It's kind of hard to read that.
Right.
I think though that that you know that pro-choice Republicans have been driven out of the Republican Party. I think we can say that for sure. Whether they've ended up in the Democratic Party, I don't know. But they continue here in Minnesota. I think we see a lot of that result in a lot of the Independence parties continuing to have some, you know, notoriety, some getting of some votes. Somebody like Dean Barkley getting in the teens. You know, somebody like Tim Penny getting, Jesse Ventura. Those types still. I believe, you know, maybe this finds a home for many of those pro-choice Republicans.
Yes, I remember Barry Goldwater.
Barry Goldwater is an excellent example. We actually, at Planned Parenthood, have the Barry Goldwater Award because he was a pro-choice Republican, and when did he run, in 1964?
Right. Yes, I was a Barry Goldwater supporter.
There you go.
Which sort of dates me, doesn't it? But it is amusing to see that change within the Republican Party, of a party of pro-choice to a party that's really very conservative and negative attitude. Well, I think it's interesting to see that some of the change, and I was afraid that the Democratic Party might start to sort of tone it down in order to win elections. And I thought that would be the wrong approach. I would hope that they wouldn't steer themselves in that direction, to try to continue to look at a pro-choice agenda and the rights of, especially for women in this area. Now, there's also a change in laws that affect foreign nationals and our own military, as I understand, that within the military you couldn't have an abortion.
Oh, sure, that's right. Yeah, yes, they do. That's right. In the health care that's provided to military personnel, abortion is not one of the services that are provided. That's right.
Now, is that law, would that be something that could be changed as a regulation, do you know?
Good question. I don't know if I know the answer to that exactly. I think it's a congressional issue, like
Okay.
what services are available to medical personnel, I keep saying that, to military personnel. And I think that is a congressional issue because that's where usually the health plans go through for federal employees. I imagine the military as well. And so I think that's a fight that may have to be fought. I do know too that abortions are never provided on medical hospitals as well, on bases, on Army bases, for example. And that is something that is always contentious as well. And usually I believe that that's still the law as well.
It is. I was hoping that it would be another regulation that he would just have to...
There was one that I actually forgot to mention at the top of the show, which is really important and is still kind of, as this is being taped, is still a very vital issue, is that George Bush, before he left office, passed what we call the Midnight Health and Human Services Rule, where basically it's an expansion of the quote-unquote conscience clause, where he would allow, basically it allowed any healthcare delivery person, any personnel up and down the healthcare delivery chain to deny a service to any person at any time for any reason and with impunity. So, for example, if you were a receptionist at a family planning clinic, if you didn't want to schedule a birth control appointment, you didn't have to do that, and you could not be fired for it. That was a rule that was put in place by George W. Bush, and it is right now the rescission order has occurred, where Barack Obama has said he wants to rescind it, but it's in the public comment period right now.
Right.
But it is currently, as this is being taped, the law of the land right now, and it is called the HHS rule, and we are working to try to rescind that rule. But it was a huge parting gift, if you will, to the religious right when he left office. It's not going to stand for too long, but it was certainly a burden to healthcare providers in this country, and a huge burden. Again, you keep saying 47 million Americans without health insurance, and we're trying to restrict access to healthcare. That doesn't seem right.
That was a sneaky act to throw in. That literally, as a boss of or the manager of a clinic, and I have a receptionist, she could be doing this, I wouldn't even know it.
Nope, she wouldn't know it. And if you were at a hospital and there was a med tech who didn't want to wash the instruments, for example, for a tubal ligation because they didn't believe in it, that person could not be fired for not doing that. So, in a remarkable, breathtaking actually in its breadth, and really throws a wrench in healthcare provision in this country. There's no doubt about it, and it is completely without merit. It does not need to have had occurred, but it did occur, and it was just a parting gift, basically, to the far right.
So it's again one of these examples of that chipping away wherever possible. Things which people don't necessarily notice because they don't end up as banner headlines, and they can get away with it.
Absolutely.
Well, perhaps they won't. We've educated a bit more this evening, and I want to thank you, Tim, for being here, representing Planned Parenthood, and in helping to inform the public.
My pleasure. Thank you, Grant, for having me.
This has been Atheists Talk. Your host has been Grant Steves. If you contact us, according to the website or the phone numbers on the screen, you may get a free copy of the newsletter. And if you have information about a topic that you would like us to cover, please get in contact with us, because if you're interested in us, we are definitely interested in you. Thank you.